The skill I chose to demonstrate is the soccer goal kick. This skill involves using your lower body to kick the ball accurately and powerfully into the goal. Some of the joints you use in this skill is your knee joint, your ankle joint, and your hip joint. When your leg goes through the action of doing a football kick, the hip is a very important joint. The bones that make up the hip joint are the femur, which is located in the thigh, and the pelvis, which is your lower torso at the base of your spine. The joint is a ball and socket joint, which means it rotates on the spot and moves freely. The hip muscles are the ellipsoid and gluteus maximus, abdominis, and latissimus dorsi. The gluteus maximus, also known as the glutes, contracts when your leg is pulled back to kick the ball. This makes it the prime mover and causes extension at the hip joint. That also makes it the agonist to the ellipsoid, which relaxes, making it the antagonist in this pair of muscles. When your leg follows through with the kick, the prime mover is switched to your ellipsoid, which contracts while your gluteus maximus relaxes. Your knee is known as a hinge joint, which is two or more bones where the bones can only move along one axis to flex or extend. When your knee joint undergoes the movement of flexion, your hamstring is the agonist as it contracts, and your quadriceps are the antagonist because they are relaxing. When your leg goes through the movement of extension, the antagonist and agonist relationship roles reverse, meaning the quadriceps are then the agonists and the hamstrings are the antagonists. In every pair of muscles, there is the antagonist and agonist relationship, depending on the action your body is doing. Not only are the hamstring and quadriceps muscles important to this movement, but their bones associated with the knee joints are as well. The bones associated are the femur, tibia, fibula, and the patella. Your ankle is an important joint in this action as it is the main movement that decides where the ball lands as it affects the accuracy of the kick. The ankle joint is also a hinge joint just like your knee and other joints like the elbow joint. The bones associated to this joint is the tarsals, which are located at the front of the foot, and the tibia, which is in the calf area. The muscles that are used in the kick and are associated with the ankle are the tibialis anterior and your gastrocnemius. When kicking the ball, your gastrocnemius contracts and shortens, making it the agonist to the tibialis anterior, which, when kicking, relaxes, making it the antagonist. These two muscles work in a pair to make the kick work smoothly. For a goal kick, your foot needs to be pointed downwards towards the ground to kick the ball with the laces. This means the ankle goes through the movement of plantar flexion. But when you first set up the kick, your foot is flat or slightly facing upwards, which means it's doing the movement of dorsiflexion. Because of this, it makes the tibialis anterior the prime mover.